Okay, Assalamualaikum warahmatullahi wabarakatuh. I'm going to tell you about the outbreak of the chikungunya. So, chikungunya is a viral disease transmitted to humans by infected mosquitoes. It is caused by the chikungunya virus CHIKV. A CHIKV infection causes some symptoms. The disease mostly occurs in Africa, Asia, and the Indian subcontinent. A major outbreak in 2015 affected several countries of the region of the Americas. The disease shares some clinical signs with the dengue and Zika and can be misdiagnosed in areas where they are common. Severe cases and death from chikungunya are almost always related to other existing health problems. Chikungunya is a mosquito-borne viral disease first described during an outbreak in southern Tanzania in 1952. It is an RNA virus that belongs to the alphavirus genus of the family Togaviridae. The name chikungunya derives from a word in the Kimako-Hunter language meaning to become contorted and describes the stoop appearance of sufferers with joint pain, arthralgia. And some mosquitoes that transmit chikungunya in Africa also live in forested areas. Monkeys and the other wild animals are also believed to be carriers of the virus. So, let's see how chikungunya can be happen. Chikungunya virus is transmitted between humans via mosquitoes. When an unaffected mosquito feeds a viremic person, which is someone who has the virus circulating in their blood, the mosquito can pick up the virus as it ingests the blood. The virus then undergoes a period of replication in the mosquito. The virus again begins to replicate in this newly infected person and amplify to high concentrations. Within the mosquito, the virus replicates in the mosquito midgut, then disseminates to secondary tissues, including the salivary glands. CHIKV can be transmitted to a new uninfected host most quickly than for other mosquito-borne viruses. Once infectious, the mosquito is believed to be capable of transmitting virus for the rest of its life. Most commonly, the mosquitoes involved in the transmission cycle are Aedes aegypti and Aedes albopictus. Both species can also transmit other mosquito-borne viruses, including dengue and Zika fever viruses. Next, let's see the chikungunya symptoms. Those symptoms usually will get ill in 3 until 12 days after being bitten by an infected mosquito. Symptoms include sudden fever and severe muscle and joint pain. They can frequently accompanied by headache, fatigue, nausea, vomiting, and a rash. Chikungunya does not often result in death, but the symptoms can be severe and disabling. Although most patients fully recover for several weeks or months, other persistent problems may include eye, gastrointestinal, neurological, heart complications, and chronic disease. Serious complications are not common, but in older people with other medical conditions, it can contribute to the cause of death. For addition, once an individual is recovered, they are likely to be immune for future infections. So next, how can we treat this chikungunya? Actually, there is no vaccine or specific antiviral drug treatment for chikungunya. The clinical management targets primarily to relieving the symptoms, including the joint pain using antipyretics, drink fluids to prevent dehydration, and get plenty of rest. Medicines such as paracetamol or acetaminophen are recommended to reduce pain and fever. Chikungunya patients should avoid using aspirin or non-steroidal anti-inflammatory drugs until the time a dengue diagnosis is ruled out. This is because in dengue, these medicines are increase the risk of bleeding. And next, how can we prevent chikungunya? So first, at home, we can reducing the water-filled container habitats that support breeding of mosquitoes, and empty and clean the container, tires, buckets, pools to inhibit the mosquito breeding and subsequent production of adults. Second, use insecticides spray to kill flying mosquitoes and can be applied at surface around container where the mosquitoes land. This can help in control mosquito population. Next, for the babies and children, dress them in clothing that covers arms and legs and covers baby strollers with mosquito netting. For adults, can spray insect repellent onto hand first and then apply to a child's face. And that for everyone, reapply insect repellent as directed. Wear long sleeve shirts and long pants, and do not forget to wear boots, socks, and also buy permethrin treated clothing and gear. For travelers, use repellent or picaridin on exposed skin. Reapply according to the manufacturer's directions. Wear long sleeve shirts and pants. Spray outer layer clothing and gear with permethrin. Buy or use mosquito net if you are sleeping outside. So that's all from me. Do not forget to always be careful and protect yourself. So thank you.